Hi everyone, it's Dr. Dave coming back to you today with this week's video. So these videos, as you know, are basically prompted by conversations I have in the office with my patients. And I had a very interesting conversation in the office yesterday with a patient, and the question the patient asked me was, Dr. Dave, is cholesterol really that important? And I asked the patient, why were they even asking me this question? I didn't even think that was an issue any longer. This idea of cholesterol and atherosclerosis or heart disease has been well established since the 1970s and even earlier. And they told me they were listening to a podcast, and the person they were listening to was adamant that cholesterol was not that important for atherosclerosis. There were other things like inflammation, etc. And I paused for a second and I realized that there's a lot of stuff on the internet, Facebook, Google, Instagram, Twitter, TikTok, everything. There's a lot of stuff that is good and great, and there's a lot of stuff that is not at all worth listening to. And so let me just back up. The question is cholesterol important? Does it play an important role in atherosclerosis? And let me be very clear. The answer is unconditionally yes. Cholesterol, in particular LDL, but other types of cholesterol also contribute to atherosclerosis. But cholesterol is very, and I will even go further, it's essential for atherosclerosis. Now, why is there confusion? Well, there's confusion because now that the internet and social media exists, everybody's an expert. So the first thing I want everybody to understand is when you're listening to somebody like myself, even me, who is this guy? Ask yourself a couple of things. Number one is, what is their background? Are they actually a physician? Are they not a physician? Number two, are they seeing patients? And number three, are they trying to sell you something? That's probably the most important, because as you know, Dr. Dave doesn't sell anything. I am not trying to sell anybody anything. This is done on my own time. It actually costs me money to produce these videos, but I do feel it's important for my patients and anybody who is interested in learning more about these topics. So going back to the issue, cholesterol. Why is cholesterol so important? Well, cholesterol is the fundamental aspect of atherosclerosis. But it's complicated, and that's the issue. There's lots of things that will promote atherosclerosis: risk factors, smoking, high blood pressure, genetics, family history, etc. So what happens is, and the way I explain it to my patients is, this is the artery. Remember, this is my model. His name is Art. This is a normal artery. And you can see that it's clean, it's pink. There's not much going on. As we age, we will all develop some plaque. That's almost guaranteed. And that's cholesterol for the most part. And some of us will go on to develop moderate and some even severe. So what we have to understand is the lining of the artery, the endothelium, usually needs to become disrupted. And how does it get disrupted? Well, it gets disrupted by risk factors. If you smoke, if you have diabetes, if you have a family history. And once this smooth Teflon-like lining is disrupted, then cholesterol can actually start to infiltrate. And it's actually not even shown in this model, but the cholesterol starts inside the wall. The cholesterol gets into the artery wall, and then it starts to accumulate and bulge out. And this is where blood flow is. And this becomes a problem because if this ruptures, then this can cause a heart attack. So cholesterol is essential in this process because this is all cholesterol plaque. But the issue is this: it's very complicated because inflammation is very important and risk factors are very important. But to deny the role of cholesterol in atherosclerosis is completely wrong. Multiple studies have shown that there is a direct correlation between LDL, the bad cholesterol, and heart disease. And to date, until today, there is not a single study that I'm aware of that has shown that too low a cholesterol is harmful. Used to think that maybe too low cholesterol can cause bleeds in the brain or dementia or suicide. We have never seen a good, now there are studies out there, but a good study teaching us that that is true. So another thing I always like to remind people is when we're 2, 3, 4 years old, our average cholesterol is about 30 to 40. That's the bad cholesterol, is between 30 and 40, right? So what is your cholesterol watching this? I guarantee you, if you're not on a medicine, it's well above 30 to 40. So it's probably too high. The question is, does it need to be treated? And that's a whole other discussion. But let me just go back to the original question. Is cholesterol important for atherosclerosis? It is critically important. What to do with that cholesterol? Well, that's the hard part, and that's where you have to discuss or have a discussion with your healthcare provider. I have this discussion all the time with my patients. If you are interested, reach out to me, and I'm more than happy to give you some guidance on what to do. If you're on Long Island, of course, come in and see me. But remember, cholesterol is very important. It's just how you frame it, and it depends on you as an individual and your risk and whether your arteries are developing cholesterol either on a carotid ultrasound or a coronary calcium score. Okay, everybody, until next time, this is Dr. Dave.